Brent, do you remember the traffic accident up north of Station 1, which was the vehicle being followed by...
Yes.
That one.
Mm-hmm.
And remember, that was where helicopters were flying, so we actually transported everybody by air because everybody was really critical. Mm-hmm. And it was a really tough call. Made tougher by... There was a dead person, a sibling of the person who was driving, and the driver was trapped. The driver had fallen asleep and gone off the road. There was no indication that there was any alcohol or anything that other than just falling asleep and just driving off the road. And do you remember it was like copse of trees? Am I not close enough? Hi everyone.
I'm just moving it since you turn your head that way a little more.
Copse of trees, field here, field here. If they had gone off the road a quarter mile before or a quarter mile after, you would have woken up with your vehicle stuck in a cow pasture, right? But no, there's trees right there.
Yeah. Barbed wire fence.
And the steering wheel and dash are compressed down on this woman's bilateral femur fractures. And she, fortunately for her, I say fortunately, is turned, the stanchions of the seat are turned so she can't see that her sister is dead next to her.
Oh, man.
And I can't use last names, but the lieutenant at the time was Sean. Mm-hmm. And somebody was using the pneumatic jaws to cut the stanchions on the seat so we could get this woman out. The car is compressed against the tree, and you can't get an engine down, so you can't like hook the dash like you normally would and kind of peel the dash back. Or if you did, it would take a long time. And we were thinking, any of us, I'm like, I wonder what happens when we take the pressure off her legs. Like, is her pressure just going to drop out? Like, do we have a vascular crisis that's just being tamponaded right now? But every time, she might actually have a spinal injury after all this stuff we talk about, because every time the seat would move a little bit, she would scream, "You're cutting my back, you're cutting my back." And at the time, like, Sean and I are both looking at the pneumatic, like the jaws of life. Like, what's the official name?
Hydraulic spreaders.
Hydraulic spreaders. And there's no chance they could be cutting her back, but she's so adamant about it that we both kind of believed her in a weird way. So I stuck my hand back behind there, and I'm like, okay, if I feel this thing starting to cut my hand, stop, right? But it's nowhere near. It's just, I think it's hurting her back because the seat is kind of pitching up when she's going. But after that call, everybody got flown out, except for the parent of these adult children. So 3 of them are critical. Was riding a motorcycle behind them and is fine, but just witnessed this happen. And do you remember after that call, we all just sat there. We were waiting for the coroner to arrive.
So actually, I was at Threes. I heard about it. I was not actually on it. Yeah,
I know that Nick was there.
I listened to it on the radio, but I was not there.
But I remember we sat on the bumper of the engine and all just put in a giant Skullmet long cut dip and sat in silence for a long time. And then when we were done, we were like, "You good?" "Yep, I'm good. I'm good." And that was it. And in like a movie, that's all you need because you're awesome. But realistically, that woman screaming, this is weird. You have no decision. You get no choice over what things bother you, right? That woman thinking we were cutting her back and us kind of believing it, even though we can see that it's not true. Like that type of weird confusion that it generates. When I'm like, "Aaron, stop holding my hand," and you're looking down, you'd probably still move your hand further away from me, right? Even though I'm not holding your hand. It was like that. Like, you're just like, okay, I'll put my hand back here to make sure. Not because I'm like, "Ma'am, I know that you think this. It's not happening." I was like, maybe we are cutting her back. Like, I don't think so. But her pleading with us that we're cutting her back while she's turned away from her dead sister, asking about her sister. Oh, just one of those things. Yeah. Later on, totally came back to haunt me. At the time, Skullmet long cut sat on the engine, and cool. Let's go do another call.
Yep.
Right? Like that's the weird part about it. That's the cumulative effect.
Well, I wonder if it's the diversity of call volume at like law enforcement or fire, to where like maybe it is just the concentrated, like you do one thing that when I started as a CP, we only did mental health calls, and I spent a year and a half just dealing with like mental health crises. And at the end of it, I was like, I needed a grippy sock vacation, and maybe like on the engine, maybe it's just a little bit more protective because you do other things and there's something else to occupy your space. Whereas on the ambulance, like that's it. Like you do that. And after that call, you were going to do another one. Yep. And after that, and you knew stretching out into infinity, that was what you were going to do. Whereas like law enforcement, you could be, you know what? I want to do something else, some lateral change in the job. And maybe that's the thing that makes.
And I think also fire is far from immune from obviously experiencing all this too. But that's a good point. I'm not sure if that.
Yeah, and I don't want to paint the picture that like firefighters are out there like, wee, like
it's great. We never get burnt out.
It's never sad. It's just cookies every day.
Well, it is cookies every day. Let's be honest. I mean, there is that.
Yeah. I mean, I work out a lot to maintain this.
But I don't know. Like,
trimester belly.
Do you feel like in your experience in the fire industry, do you feel like it manages resiliency and burnout better than EMS?
Yeah, it. I mean, that's a good question.
Yeah, I don't know. Like
I think the ability to do other things, like the ability to focus on fire and fire training and the different diversity of calls that we do run is beneficial. I mean, at the department I work for, we're not as busy as the city next to us for sure. There's companies in that city that run significantly 2, 3, 4 times more calls than we do, that our station, our engine does on a regular basis. And that's,
But more resources, and those calls tend to be, at least in my experience, of less acuity.
Correct.
Like, you're going to be the only lieutenant on scene to, at least initially, to a 2-car TA that's significant, that's going to require. There's a lot of things going on there.
Sure, and depending on the day too, like it might be it, period. Or we'll probably get a battalion chief or something. It's on my shift for sure, but yeah, absolutely.
And that factors in too, right?
Yeah. Just like being out, kind of on your lonesome with your stuff flapping in the wind, as it were. Yeah, because I did contracting for a very brief period. I went to Afghanistan, and I worked on Kandahar Airfield, and I was like as safe as could be. Like honestly, like greater risk running an ambulance downtown,
right?
Like much greater risk of someone, But we had a different call volume, and it was exciting, but we did a lot of different stuff, and it was never alone. Like at no point were you the solo provider. There were 3 medics and a PA that worked together, and then you were part of this whole apparatus. So I mean, like worst case scenario, they went to the Roll 2 hospital. And so I wonder how much of it is just like the awareness that you're part of a team. And that was the great thing about the last place that I worked, was that the people were amazing. So I don't know, like the question of what creates resiliency once you're out is an interesting question.
That's another thing too. I mean, the team's big enough to where if you're having a bad day or you're not wanting to deal with this, you could step back and someone else will fill that role. Maybe not so much as in the officer side of things, but as you're burnt out from whatever the case may be. You run a bad pediatric call. You can take a step back and run the computer for a second. Typing up your
you're right.
And someone else can jump in and actually get their hands dirty, so to speak. And so there's just having that bigger team, and everybody that you have worked with, you live together too for pretty much a third of your life, right, at this firehouse, and just having a bigger team, bigger family to kind of watch out and take care of you. Different personalities.
Brent, do you remember that?
I do.
There's a series of photos.
Brent always
every
remembers.
time. Everything. He
curse.
certainly remembers me stabbing the seatbelt.
I wanted to revisit when you were like, I don't remember ever being rude to a patient. You also don't remember trying to murder an inanimate object.
Yeah. No, I remember throwing numerous things, but never the seatbelt. Probably because it was just attached. But yeah, that's That's
but
the
you were
thing that
stabbing
probably
like
happened.
next to your. I thought you were gonna stab yourself.
It's a possibility. But I took a series of photographs
I wish there was video of that.
Brent.
Am I doing that?
Yeah. So every time we went to a fire, it could be a vehicle fire, it could simply be a chicken coop, or just a smoke investigation at a shed, and there is some smoke. Brent would come over at some point, and then get down like he was keying up on his mic and point in the wrong direction of the fire, and I would take a picture of it. So I've got a whole series of these pictures. And then later on, do you remember that it was when Brent and I went through a period of brewing our own beer?
Yes.
And it was status single.
Status single, which got changed to
celebrating
status
Brent. Yeah.
Shingle.
That's true. But there's doesn't the label that
I can't remember. Did
my
Annie,
wife?
did
Yeah,
Annie
Annie
change
made
it?
the label. Was you going like you're talking on your mic?
Was it single or shingle?
It was single,
It was single,
but we like just jokingly.
Okay.
Because and this the thing
that was
is
a good
like
time.
Mark has done
Army
so
of
much
two.
community medicine. At this point, you would have been able to identify shingles right away. But Brent's like, man, it really hurts right here. And I'm like, man up, dude. Come on.
Yeah.
And then who died immediately was Nick. Immediately was like, you got shingles. I'm like, no. Went to the doctor, and sure enough, like, my eyes look like a monster.
I know. And you hung out at your house for like 2 weeks. Like, I'm not leaving.
No.
Yeah.
But I was under the influence of Percocet because it was incredibly painful, but that euphoric side effect of it,
Plus,
definitely.
the video game. Back in the day when you couldn't just stream your video games, you actually had to purchase a video game.
Right.
The video game Army of Two, which I was explaining to Mark on the way here.
I've never seen it. I've actually never seen. Like, it's not like I'm some kind of like video game expert, but I'd never even heard of that.
Look,
game.
you
do you remember how
have
he does
never
it?
felt the camaraderie and felt as close to someone as when they have your back during this game.
This is it.
I'm going to run from this car to that car, but Brent's on the sniper rifle behind me, and I'm good.
Do you remember how he designated bosses?
It was fantastic.
Oh, it's so good.
And we had brewed beer, so
Yeah.
it involved. Although at that time, actually, that was during the status shingle period. You were like, I'm not drinking.
Yeah, because I was on Percocet.
and
So
I'm
much Percocet,
and I'm
yeah.
super sick, and I just need to focus on getting better. So actually, I don't think we'd brewed beer yet.
No, I think that was.
That came after.
Oh, my shoe came untied.
I can't remember, but either way, fantastic times.
Oh, it was great. It was.
Yeah, and then Aaron came out and it all changed.
Aaron.
Yeah, just
Yeah,
kind of
after
like when
that
he walked back in the room.
Yeah. This is the whole point of this story is actually Aaron.
So
Ruined.
I did attend not one but 2 law enforcement academies, and Aaron, looking down at his phone right now, is what they call in law enforcement a clue that we need to change topic. It took me 2 academies.
You know,
It took me 2 academies.
can we? What's your favorite brownie recipe?
The kind that I can't eat until I stop being a first responder.
What? Oh, yeah.
Sorry. Come on, Mark.
yeah.
Apparently,
Yeah.
Mark's not waiting until he.
I'm not
Look
a
at the
first
beard,
responder
man.
anymore. You know, like
Yeah, the beard is also what we call a clue.
The beard will test positive for THC.
jacket. Come on, man. Like,
I didn't even see you were wearing a jacket. The
full-
camouflage is
full
amazing.
Midwestern regalia here. This is like what we call Wisconsin semi-formal.
Semi-formal.
How do you avoid burnout in law enforcement?
That is a great question, and I am hoping to learn from my previous mistakes. I don't think burnout in first response is different between, say, law enforcement and paramedicine or fire or who else shows up first?
That's
like,
it.
Mall security. Like, who knows?
Yeah, I don't know if I'd call them.
But I don't think that the process, like
You've
drive.
clearly
Like-
never known.
I mean, or let's talk about, like military or anybody
Sure.
that is in stressful situations cumulatively, right? I don't think it's any different. So I don't think that there's something special about law enforcement, but I did end up going and talking to somebody and doing the EMDR I do this because apparently it used to be lights, but now it's just
You're
paddles.
holding on to something.
Yeah, which you feel like are going to shock you because like it should, but they resemble the whatever they give you at a restaurant where they're going to allow you to come up and get your own food.
Oh yeah.
They still expect a tip, but like, oh, my food's ready. Like, I'll go get it, right? They resemble those, and it for people not familiar who may be listening to this and haven't stopped listening, but at this point, it buzzes left hand, right hand, left hand, right hand, which is activating right brain, left brain, right brain, left brain, as you then talk to somebody about situations that theoretically are still to some degree lodged in your amygdala and are still eliciting an emotional and physiological response. And so the thought is that it assists you in processing them into memories, which are very easy to talk about, versus experiences, which will make you angry or sad or upset when you talk about them.
So kind of moving it out of your like subconscious mind to somewhere where you can actually articulate kind of the situation, I guess.
You could articulate it before, but you wouldn't want to talk about it. Or when you did talk about it or anything, you would get super, like in my case, just super pissed off. Like super angry. And also like there's a, like it's weird. I don't think I've ever shared this with anybody, but like the camaraderie we had, we were a tribe and everybody brought something to that tribe.
100%. Yeah.
And that was the when you say, what do you miss the most? That. Being part of a group of people that, I love, and I love for what they bring that I can't do, and they love for what I bring that they can't do. You know, all of the people on that tribe, which was C-Shift, could have been paramedics. They just hadn't got to school. Like the level of knowledge and ability was high, and the level of empathy and compassion for patients was high as well. But we worked together like super well. But with that comes when calls don't go well, a sense of like helplessness and shame that you didn't live up. That Brent might go home feeling really, really good because we ran a pediatric arrest and got the kid back, or we ran a high acuity TA and we got the person cut out of the vehicle and on the helicopter very, very quickly. Everything that needed to be done was done, right? And we all felt good about that. But when the outcome wasn't good, I felt like that rested on me, and there was nothing that anyone ever said or did that made me feel that way. It was totally coming from my own expectation. So like that played a huge role in it too, right? So not just feeling like, oh, I saw this horrible thing, but feeling like I deliberately selected to go out there to put myself in that position because I felt that I was good enough to handle those high acuity calls, and I wanted those calls. Nobody wants a baby to die, but if that baby was going to die, I wanted to be the one to be there. And then you get the added bonus of being respected for doing a good job with these people that are around you that you love, like you really love them. But then the shame of when it goes bad, and like I use shame kind of loosely because I think that it might be, the Germans probably have a word for it, like they can combine different words. I don't know exactly what it is, but the feeling of having both let your tribe down, let the patient down, and that it was your ego that put you in that position to do that. Like I thought I was good enough, so I went out there and I got all the credit for being good enough, and I wasn't good enough. And so that was like that was what I had to overcome when I actually finally went and saw somebody for burnout.
What do you think, what kind of things did you feel like you weren't good enough? Was it like a skill that just didn't go smooth, or something didn't happen fast enough, or like what would be something like that?
To answer your question, before we move on, is that finally admitting that I should probably go talk to somebody, which is part of, you had kind of primed us with like, hey, bring a story that was impactful. The story plays into it. But when I was in my first law enforcement academy, that agency, not the agency I work for now, had a doctor that was specific to that agency. And she came in and gave a presentation, but brought at that time, deputy in who told like his like story of a really, really difficult call that turned into a struggle for his life against a man and a woman on scene next to a vehicle. And I believe, I'm not remembering it super well, but I believe he ended up shooting one of them. And then finally backup arrived. And for Brent, you know what sheriff's agency I'm talking about, where we would often stage and wait because they were so short-staffed for
100%. Yeah.
half an hour. So your backup is, even coming code 3, might be half an hour away. And this guy told an just incredible story. And not incredible that the story was unique. There are people out there that have been fighting for their life next to cars on traffic stops since there were cops on cars, right? It was the honesty and the self-analysis and assessment that went along with his story that he's recounting to 35 people he doesn't know with the then counselor that he had gone to. Because his story also included a resting heart rate of 150 or above for days following this event, like a hyperadrenergic response that didn't go away. Like they brought him in and assessed him for SVT, and they're like, no, we can sedate you, but it's, sinus tach. It's just purely, his brain is just in fight. Like the fight continued for him after backup got there and he shot somebody, right? And that guy planted the seed for me to eventually realize, you know what? If that guy can do it and be so honest about it, I'm going to go in. And the first day I went in, I was like, I called that same woman and she was like, I'm too busy, but I have somebody that I practice with. Who was a guy. And the first day I went in there, I was like, here's the deal. I feel that it's weak that I'm here, and everybody that I hang out with would consider me weak for being here. And I will never, ever tell anyone I'm here. And then as soon as it worked, I'll tell anybody. You guys are going to have to stop me, or I'll stop myself from dominating this conversation with like how awesome it was to finally get to a point where I could talk about them. And if it was the EMDR, maybe it was, or maybe it was just an objective dude that doesn't know me to talk to. I couldn't tell you because they were simultaneous. But he was awesome because he only does counseling for first responders, military, law enforcement, EMS. And so when I said that to him, he gave me like the biggest like bitch please look. He was like, yeah, I've never heard that before. And so I don't know, you had a similar experience perhaps?
Yeah, something like that. Yeah.
Yeah.
Very similar. It's just recognizing going in and being just embarrassed, I guess, that you're there, or like you feel weak, or whatever the case may be. And now after you're through it and you've recovered to some degree, just can't stop recommending that people suck it up and go. Like just anybody who's like,
go on a podcast and admit it.
Yeah, absolutely, 100%. We all will go through this. We'll all suffer through all these micro traumas, and just recognizing it early now. Like that's my biggest takeaway from having dealt with this is recognizing early. Like I've ran a bunch of calls that I know are going to mess with me. I think I'm fine right now. Let's just go talk about it. Let's go deal with it early, and let's get it kind of addressed before my family suffers or something for me having my getting angry easy or just whatever the case may be. Yeah. So 100%.
Yeah, and it was funny. One of the questions this guy asked me was, he's like, well, do you have a good metaphor for the way you feel? Because that was my problem. I was just like super, two weird things. I would get super pissed off when I thought about this stuff. And when I thought about it, wasn't a decision when I thought about these calls, wasn't a decision that I got to make. But maybe this is just ubiquitous to everybody, but like when you want to get something out of your head that you're thinking about, will you say stuff out loud?
No, that's crazy.
Okay. And Mark is actually in a really good situation to be able to diagnose this. Because like I would start thinking about it, I started getting super pissed off, and I would just like literally, no matter where I was, I'd be like, oh, it's fucking stupid. I mean, literally, like next to my kid watching TV in a line in the grocery store, and it would come in and I would say something like that. That's when you realize you're like, oh, maybe I should talk to somebody. Like I am actually, and I wasn't saying anything. I wasn't telling a story. I wasn't showing any emotion other than anger. But the guy was like, well, can you, give me a metaphor? And he's been dealing with soldiers and stuff for a lot. So he's like, for example, like, do you feel like you're, in a house that's on fire, or maybe you're lost and alone in a dark forest? And I was like, no, man, I feel like I'm trying to carry too much stuff in from the car, and it starts falling out of my hands, and pretty soon I just throw all the groceries down and stomp on them, or stab my seatbelt. Like that. That's the closest thing the way I feel about it.
That's so
just
funny.
like That's still this bullshit. None of it's significant. I just don't want to make 2 trips to the car, so I'm going to try to carry 4 bags.
I wonder if women in EMS deal with this a little easier, because I think as men, like, our gut instinct is anger.
Oh, that's a good point.
And a lot of people think that's like, that means we're not emotional, even though we are emotional. It's just the emotion is anger as opposed to, I don't know, sadness or fear. And I think they're a little bit more open to talking about stuff maybe than men in EMS are. But
not to get morbid, I wonder what the suicide gender breakdown is for first responders.
I had those statistics somewhere, because light reading.
I would assume it's.
I don't think it's split.
Men in general are much more represented in EMS. So I would assume it would be hard to analyze, but you have to look at it like proportionately. There's probably 20% women in EMS versus like 80% men. So you'd have to break it down a little bit, but
I think as 4 dudes in a room, we're definitely qualified to speak on
half of women,
the female experience going through EMS.
So here's my gut feeling.
Here's the thing about the ladies. Like,
I could have my wife.
This is a back.
Goes, yeah, this is it. This is the end.
I can have my wife come down and she could tell you how angry I was as a paramedic.
Yeah, isn't that weird? Like, I don't know, Brent, has that been your response too? Was it being like super pissed off?
Yeah.
For no reason. It's not like something would even happen. It's not like, oh my God, I stubbed my toe and I get super mad. I would just get super mad.
Yeah. I mean, I think I've seen my like anger and frustration level baseline much lower now as a PA than when I was a full-time paramedic. Like, I think I just had my threshold for losing my temper was so much lower when I think from the chronic burnout stuff you talk about. And I don't even know at the time, I probably would have told you I wasn't burnout, but looking in hindsight, I think especially in those latter days on the 48-hour shift, looking back, I'm like, I can't believe I dealt with that level of stress every day at work.
And despite that, I'm still proud that I was able to pull off 48-hour standing shifts, which is part of the problem.
Yeah.
But I'm still stoked. Like, yeah, you think you're tough.
Well, those shifts those shifts out there, the acuity made me a good paramedic, in a hurry. Cause you had to do so many skills, and the patients, they waited until they were very, very sick to call. And then you're with them for so long, especially if you can't fly them out. You just don't get that in the urban environment.
But you were there for that reason, which doubles down on the feeling of when you do screw up, and you will screw up. It's medicine. You're going to make the wrong call.
Yeah.
Or that tube's not going to go in.